Hello again, students. Woo! Okay, so now I'm going to show you how an FMX should look like on the screen. So an FMX stands for full mouth x-rays. So full mouth x-rays can range from 10 images to up to 21 images. So here at the school, we're going to do 18 images, which is the same thing that we did at the table with the XCPs earlier. And it's the same order for your handout that we talked about earlier, okay? So again, red, blue, and yellow. In the red, before you go in the patient's mouth, assemble everything ahead of time. And remember, you have to open sterilization packages in front of your patient. So don't have it set up before they come in. So as you sit your patients, you open everything up and set up already in the order in which you're going to take your x-rays. That will save you a lot of time and less cross-contamination. Okay, so same thing again, right? Our chair, and then the step, and now we have the ring and the vertical angulation. And the yellow one, the posterior periapicals, I set up first for the upper right quadrant. So all of my XCPs are ready to go. And so right now I have a picture for you guys to see how the computer will mount the order in which you're taking your x-rays. So the ones in the middle here, are the bi-wings. So we have the molars of the upper posterior teeth, the molars, and then the molars of the mandibular teeth, maxillary and mandibular. So the bi-wings is showing in between bone loss, interproximal bone loss, and interproximal cavities. So that's why bi-wings are so important for doctors to give diagnosis in cavities, okay? So those what the bi-wings are for. And also for pathological conditions, some endodontists, root canal specialists will also want to see a bi-wing. And now for periodontal disease, which is bone loss, sometimes they have to do a vertical bi-wing. That is very, very uncomfortable. So that can also be vertically. I'm going to show you how to take a bi-wing on Dexter over there, our patient. Not quite yet, but I just want to show you that your sensor needs to have a barrier, okay? Because it's going to go inside the patient's mouth. So you have to change your barrier after each patient or if it's ripped, obviously. Okay, now, the sensor that we have here at the school is a size 1 sensor. They go from 0 all the way to size 4. So 0 and 1 is usually on children. 1 for an adult is really hard to do posterior teeth with a 1 on an adult. It's more for the anterior teeth. But since Dexter over here, our patient, has a small mouth, we have to use a 1 on him. Okay, but we don't get perfect x-rays on him because he's a very difficult patient, but that will give you the training how to place your x-rays and how to do the angulation properly. Remember, as dental assistants, we're not giving diagnosis, so don't worry about if x-rays are where you can see the apex at this point, because I promise you, if you do the techniques we're going to show you here at the school, and we're going to apply them in the office with the correct size sensor, you're going to be very successful. Okay, so that was the bi-wings, and then again, the anteriors. Remember at the table we talk about 3 images on the top, canine lateral, and then our central lateral canine, then we go to the bottom, and we do the same 3 images. And then again, we have the yellow ones, right? Molar view, premolar view. Molar view, premolar view. Then we switch the yellow one, we go to molar on the upper left, premolar upper left, molar lower right, premolar lower left. Okay, so now I'm ready for Dexter. I'm going to show you how our system here works. So, and this is something that's going to be a lot easier for when you're here on campus, okay? But I just want to give you guys a general instruction because then I wanted to make sure that you're ready. The computer will tell you where to go. When it's lit in green, it's telling you the first image you have to take. Okay, so I'm going to do our bi-wing image first. Now, when placing your sensor into the bi block right here, this bi block is interchangeable with size 0 to size 2. This is a size 1, remember? So you're going to place it like so. Make sure that your cord is in the same direction as the frame. Because if you have your sensor this way, the sensor will be inside the patient's mouth, and you're going to have an inverted image. Remember, if you have a sensor with a cord, there's cordless ones too, but then you have to figure out which direction it will go. Is this way. Okay? Now, let me take the ring around for a second. When you're doing your bi-wings, you don't want to have more sensor on the top or bottom. You want to try to have your sensor kind of in the middle. So you're able to do the upper and lower molars and premolars. Alright, so let's go place this in Dexter's mouth. One very important thing, you always want to make sure you give your patients a lead apron that has a color. And if they have any partials, dentures, piercings, anything that's metal, it needs to be removed. There are times they can remove it, so just leave it alone, okay? Now, for panoramic x-rays, they have to remove all of the jewelry, and that's something that you have to make sure your patient's responsible for their belongings too. So standing in front of your patient, you're going to retract your patient's cheek, and you place between the molars. I always look at my bottom teeth because it's easier for me to see. And then you place between the teeth and the tongue. Tell your patient to bite down. And I'll tell you guys, when you're here at school, the hardest thing about him is closing his head. He's not a very good patient. Again, place the ring as close as you possibly can to the patient's face. Now, the x-ray machine, this is the PID, okay? That's what's going to help you line up with the metal bar right here for your parallel angulation. Horizontal angulation. So you want to make sure that your PID is parallel with the bar. Because if you like this, it's no longer parallel and will cause your image to overlap. That's the most critical error with the bi-wing. So I'm going to take this one for you guys to see how it's done. I kind of go back a little bit, make sure it's lined up. And sometimes with Dexter it's a little bit harder because it doesn't have the weight like a real person to bite down. So it makes it harder for us to line up. So now to expose the x-ray, you want to make sure that you are 6 feet away from the primary beam. So right here is the primary beam. You want to make sure you're 6 feet away so you're not exposed to radiation. Then you're going to hold the button down, the exposure button, until you see yellow here, okay? And that's our first bi-wing. So I did a good job. Ooh, thank God, because I was on camera too. There was no overlapping. So I got my molars of my posterior teeth here, my molars of my upper right, and my molars of my lower right. Okay? So then what we'll do, I'm not going to do a full x-ray on the video, but I was just showing what I would do next. Then I would slide it forward, do my premolar, then line it up again, walk away, press the button. Then, remember, you just flip from right to left. I don't even move my body, really. Just tell the patient to go towards you. You can turn your machine very carefully not to hit your patient in the head. Have your patient turn towards you. Then you line it up. Then we're going to try this one so you guys can see. Then I'm going to hold it down so you see yellow again. Now I took my left image. It's kind of okay that I cut off over here because the sensor is smaller, but I'll be able to see this image on the next picture. Then if I wanted to do the premolar, slide forward again, line up your machine, and press your button. I'm only doing one per quadrant or side so you can see it. Don't worry, you're going to be able to take a full mouth by yourselves. And the same thing now. See how I placed that sensor for the interior periapicals? The cord following the metal part, the frame, okay? So now I'm going to go. So the computer wanted me to go to the canine and laterals. So I'll go ahead, place the machine, press the button. But right now I'm only going to take the central so you can see. So you're going to line it up. The metal part with the PID. Nice and parallel. So I'm going to go over here. I have to skip because the computer goes in a certain order, so I'm just kind of cheating right now. So now I'm on image 6, which are the centrals, the periapicals of your front teeth. Yellow, let go, and there's my 8 and 9. Okay? So then, if I were to take my next image that the computer wants me, I'm going to go over here, line it up, then press the button. And then I'll flip, do canine and lateral, and then I'm going to do the centrals at the bottom so you guys can see. I'm going to come over here, move my two centrals. Yellow comes up, let go, and that's my centrals right here. Okay? Then I'm going to move to the yellow ones. Now we're going to do the periapical of the molars. Now, remember when I told you at the table, this is a horizontal angulation. If you try to place this sensor like this in the mouth, imagine that up here. It won't fit. It will hurt a lot. These are the most uncomfortable x-rays. So again, you want to put it horizontally. Always place the sensor in the direction that your ring is. Okay? Horizontally. So the cord, same direction as the metal part. So I'm going to take my molar view. Bring it closer. Then you're going to line this up. Now these images are hard to take on the mannequins because they don't have palettes. So it's hard to get the apex on here. So now I already switched to my molar view of my periapicals of the posterior teeth. And let's see how it comes out. There you go. I was able to get some of the apex, but this is kind of foreshortened a little bit. You see how the root's kind of shortened? That's because the sensor is small for his mouth. Okay, so that's my molar view. Then see, the computer tells me to go forward to my premolar, but I'm going to skip to the bottom, to the lower left, so you guys can see how to do that. So since I know I'm going to go down here now, upper right, lower left, I'm going to flip my machine like so, because that's what I'm doing next. Then I'm going to turn down here. And why did I do that? Because remember, the metal part is away from the patient's face. So line it up. Sometimes the machine kind of drifts away, and it doesn't necessarily need to touch. If it was a real patient, you can ask them to move towards the machine, and so you can line it up better. It's kind of easier to do it on a real person. Not the first time though. Then you're gonna hold it down, see yellow, and I kind of got it. So I missed the crown of the tooth here a little bit, but remember, when you're doing a periapical, the most important thing that the doctors will want to see is the end of the root, the apex. Everything that's around the apical area. So periapical is when you can see from the crown to the apex. The crowns of the teeth, the doctor can see clinically, but if there's something going on right here, they want to rather see the root. God forbid, in your dental office, you lost or your sensor tube broke and you had to do insections, that's what we have to do. Now I'm going to, the computer wants us to go to the premolar, but I'm not going to do that because it's just sliding it forward, but I'm going to change to image 15. So you guys can see how to do that. So, image, whoo, that was a good catch. So image 15 will be right here on the upper left. I can't put on the upper left this way because all of this will be inside the patient's mouth. So what I do, I take their sensor out, and remember, I hold the bite block with my, in this case with my left hand, and then I'm gonna flip my metal part to the other side of my bite block. And remember, I still need this in the center, right? I'm going to flip like a pancake. Now I have everything away from the patient's face. Place your sensor again in the direction of the bar. Go to my area. That's my molars of image 15. Hold it down, let go, and then we have it. And then again, the computer will tell me to go to image 16, which will be my premolars of my upper left. But now I'm going to skip to image 17, which is my molars of the lower right. There you go. So, bring the machine back to the right side. Carefully not to hit the patient. Then from here, you flip, just like an X. Okay. Go ahead, have your patient bite down. Line up the machine. Do the button again. Yellow, let go. Make sure you take this out of your patient's mouth when you're done so they're not dying or gagging. And so when it's a real patient, to disinfect, all of this has barriers because you'll be touching the computer, touching the patient, going back and forth, cross-contaminating. So as you learn from sterilization or week 2, you would have to take these gloves off, wash your hands, put your utility gloves on, and then you're going to change every single barrier. Just don't wipe your barrier. You change everything to your barrier. Okay, that's the right thing to do. So, and then these XCPs, when you're on campus, I'll show you, you just sterilize them, okay, just like any other dental instrument. These are okay to go in the autoclave. So now, let me show you what x-rays I took. The computer automatically mounts it for us. So right here, I remember I didn't took all 18. I just did my first bite wings, just so you could see how it's placed in the mouth. And so there you have it. Now, on full mouth x-rays, it's taken every 3 or every 5 months. Those are preventive x-rays. It's not every time you go to the dental office, they're gonna do 18 images. Once a year, when you go, you have to go to your cleaning twice a year. In that year, they're gonna do checkup x-rays. Usually it's something similar to this. They would do actually 4 bite wings, molar, then premolar, molar, premolar, and then they do one of the anterior on the top, and one of the interior on the bottom. Those are your checkup x-rays. That's once a year. Full mouth, every 3, every 5 years. Hope you're listening because I'll be quizzing you later. And I know it looks very frightening at first, especially on the textbook. It makes it very confusing. Watch the video as many times as you want. And then we're on campus. You're going to just work on Dexter. So see you soon.